Good morning. I'm Neil Sheridan, the Executive Director of the Michigan Townships Association. And this morning I'm joined by your board of directors, 30 individuals from every corner of our state, as we get a chance to meet with Governor Whitmer to understand her perspectives on the current state of our economy, on the state of working from home, and a little bit more about the Stay Safe plan and the implications for us as township leaders. In addition, the board of directors have submitted questions that we've provided to the governor's team. She'll be addressing some of them in her remarks, and I'll have an opportunity to pose a few of them to her at the end of our session. So we hope that you'll appreciate this chance to hear directly from the governor about some of the changes that she is anticipating for the state as we move forward from the crisis into the recovery. So welcome, Governor Whitmer. We very much appreciate you taking the time from your busy schedule to be with us. The Michigan Townships Association Board of Directors has been looking forward to this for several weeks, and we greatly appreciate the help of your staff in developing our discussion today and the questions. In particular, we'd like to thank Ron, Judd, Jen, and Kara for the guidance they've also produced with us over the last few months on FOIA, OMA, cemeteries, notarization, some other key topics that certainly affect our residents as well as our township officials. More than 6,500 elected officials are members of the Michigan Township Association, Governor, and tens of thousands of more township employees, volunteers, commissioners, and so on. So it's this group that I think is particularly appreciative of having this chance now. After the beginnings of the crisis, we've had a chance to learn about the situation and have heard the directions you've given us as the state, and now looking forward to learning more about phase 3 and these different stages that you anticipate. So thank you very much.
Yeah, thank you. Thanks for having me. I appreciate your time. I know that in these uncertain times, it's really important that everyone with a constituency, with a platform, with responsibility toward others, I think is really such a critical position that people are looking to us for reassurance that we're going to get through this, to know that we are making decisions based on facts and information, not political conversations and what our own interests are. And so I think it's really important that we stay close, and I appreciate the leadership of everyone who is a part of this organization and on the call. 8 weeks ago, when we first realized we had COVID-19 in our state, we were in a crisis very quickly. Our numbers were increasing exponentially. We had hospitals that were already at capacity in the very early days, and we only had enough PPE, that protection equipment, to get through a shift. Not even a day's worth at many of our hospitals, but a shift. We had nurses and doctors that were wearing N95 masks for days, as opposed to changing it out every patient they see, which is the normal protocol. And it was scary. And we still, even though we're the 10th most populous state in the nation, we still have the 3rd highest number of deaths. So COVID-19 we've had a very hard experience with COVID-19 as a state, and it mandated that we take incredibly aggressive actions. Those actions have worked. By and large, the people of our state are doing the right thing. We've seen our numbers start to flatten. We've been able to build up PPE and resources in our hospitals. The stay-home order, while each of these orders that I've had to issue has been hard and it weighs heavily on me, and I know the sacrifice that people are making, they were absolutely necessary to accomplish these goals. And so we're now at a moment where we can start to think about what does re-engagement look like and how do we safely re-engage. I think every one of us is eager to do that. I can tell you, I'm tired of staying home, and yet I know until we've seen these numbers continue to decrease and we've ramped up our testing and our tracing, it's really important that we all continue to do our part. So throughout this process, I've been making decisions with our healthcare professionals who are on the front lines of the crisis, the leaders of our healthcare systems, been working with experts both inside Michigan and across the country. As we continue to navigate this, Dr. Khaldun, who is by my side at every press conference, has been by my side figuratively in terms of informing the work that we've done. Been working with epidemiologists and experts at the University of Michigan Public Health. We've paneled a group known as the Michigan Economic Recovery Council. They've been advising me. This is made up of leaders in business, leaders in health, so that we are really strategic about assessing risk inherent with different sectors of our economy and how we mitigate that risk through appropriate protocols. We've worked with trade associations and national experts, the people that if you watch CNN or Fox News or MSNBC, you've seen a lot of the same experts talking to the nation, people that I've been able to talk to directly. And we've seen, we've made a lot of strides here in Michigan over the last 8 months, 8 weeks, I'm sorry, it feels like 8 months at times, but 8 weeks. I think that one of the most sobering moments of the last 8 weeks was early on in a phone call with the nation's governors and the White House, where it became very clear that we were all going to have to go about procuring this PPE on our own. And so I set up a global procurement office within our State Emergency Operations Center. And because of that, we now have, ample PPE for a matter of weeks, as opposed to that one shift I was referring to early on. COVID-19 though, and while we've seen our numbers flatten, we've built up our PPE and our testing, COVID-19 is still present in 79 out of 83 counties in Michigan. And so it is still a very real threat. We can take a breath because the work we've done has contributed to this moment where we can think about safely re-engaging, but we have to be really smart. So the only thing that's really changed in the last 8 weeks is that we're aware of what measures we need to take as people to prevent community spread. And we've also been able to build up on the public health side and the healthcare side, but we've got to stay vigilant. The group that I asked to provide some advice to me, the Michigan Economic Recovery Council, divided our state into 8 regions. They looked at our natural labor sheds, which is where people live and work, and how much travel they do. So the geography of our state in terms of labor sheds. Then they overlaid them with the geography of our healthcare system. And so they came up with 8 regions of our state, which we're measuring and we're building out our infrastructure. The council addressed a number of issues with the epidemic, and with this information they provided me, we developed 6 stages of recovery and what that looks like. I shared that last Thursday. What we know is that when our country confronted the 1918 pandemic, the flu pandemic, we were able to look and see what happened across our country when they thought they were out of the woods. Areas that re-engaged immediately and dropped all the social distancing that they had been doing during quarantine saw a second spike. In some of those cases, it was more deadly and more economically devastating than the first. In others, where they slowly re-engaged, they did have a bit of an uptick, but it was manageable and they were able to continue re-engaging, and their economy benefited because of their discipline. We're seeing the same scenario play out now in other parts of the globe that are trying to re-engage after COVID-19. Singapore, which was the gold standard when it came to the lockdown, the stay home, re-engaged quickly, and they've got a second wave, and we've got to avoid that. And that's precisely why the 6 stages of the My Safe Start plan is really important, so that we can mitigate the risk of re-engagement, assess it, measure it before we take the next step. We're looking at this as a dial, not a switch. And I know that people, anyone who's watched me has heard me say that many times at this point. But we have to be really smart about how we turn that dial and re-engage. So the first stage was uncontrolled growth. That's where we had the exponential growth of COVID-19. The second stage was persistent spread, where we saw high case levels continuing to spread throughout communities. Then we saw flattening, which is where we are now. Our epidemic is not increasing at the exponential rate. Our healthcare system is sufficient for current needs. This is where we are now. So we've reopened construction and manufacturing with strict safety measures. We need to continue practicing strict social distancing, face coverings, safe workspace practices. We need to continue ramping up our contact tracing and containment. And we're currently permitting and encouraging people to get outside. But distancing and face masks are really important. The fourth stage, fifth and sixth are improving, containing, and post-pandemic. And you may have taken a look at some of the work that we put out on the website on Thursday, but if you haven't, I hope you'll familiarize yourself with that. The things that could cause us to have to move backward are if we start to see spikes, right? It is if the percentage of positives increases dramatically, or if we see the number of PPE needed or the ICU beds being occupied. Those are the things that we have to watch. It's really important we see this through, and we've got to stay nimble. We've got to monitor the data. We have to be able to pull back if necessary, if we start to see cases that might overwhelm a hospital system. And we've just got to be ready to do that. So the things that we are looking at will be the sustained rise in positivity rate, a sustained increase in hospital admissions for COVID-19-like illness, reduction in hospital capacity, threatening surge capabilities, or significant outbreak in a region. So I think that this is kind of the overview of where we are, how we want to take our next steps. There's no one more eager than I to take that next step. And so it's my great hope that with your partnership and your continuing to educate people in your communities, that you encourage people to stay vigilant, to do what we know will prevent community spread, and to continue to work together. We've got a lot that we're going to need to tackle together, and this is going to be a while before we can say we're fully recovered economically or as health indicators, but we're on the route, and we've just got to continue to be vigilant. And that's why I appreciate your leadership and the opportunity to talk with you today.
Thank you very much, Governor. You know, this is the Michigan Townships of 1,240 local units. As you know, it was originally a strategy to help develop our state from a territory. And these thousands of individuals are concerned about their ability in the face of declining revenues virtually immediately and certainly over the coming recovery period. The federal government sent the original $3 billion of CARES funding. How do you see that being distributed to the local units in Michigan?
So I'm glad you raised it. You know, the CARES funding, we're really grateful for it. We're still hoping that there will be a fourth supplemental coming. You know, I recognize that, like the state, local governments are on the front line of battling COVID-19, and thankfully FEMA disaster relief funds should cover a large share of some of the direct emergency relief costs for both states and local governments. Currently, it's a 75-25 match, but I have requested a waiver so that of that match so that it could be 100%. We've not heard back yet, but I do have a call with the White House this afternoon, and I'll be raising that. The CARES Act Coronavirus Relief Fund provides about $3 billion to Michigan, and currently its uses are limited specifically to COVID-19 costs. We've been working with our bipartisan congressional delegation as well as the National Governors Association, which I'm really grateful for. It's the bipartisan governors across the country. We are working to try to ensure we've got the flexibility that we need so that we can use some of these dollars to backfill revenue losses. And we're still waiting on federal guidance and a potential congressional amendment regarding the use of those funds. I have been in communication with, I was talking to one of our congresspeople right before we jumped on this call, and I know that they're keenly aware of how important this is to you as well as to our state budget. We anticipate that our revenues could drop by $3 billion in FY20 and even more in the next fiscal year. If we can't use those CARES Act dollars to backfill, then we would have to brace for deep cuts. And with the revenue estimating conference on Friday, that's something that I'm hopeful we don't have to go as deep as what $3 billion would dictate. And if we get that flexibility and some additional funds, we can stave off some of that. But that's really what's at stake here. Thankfully, I understand your members are I get that your members are also facing revenue concerns, and at least your primary revenue source, the property taxes, are not expected to decline. And so I'm glad for that will help on your budgets. I would just add that I've been working to advocate that the President and Congress provide states and locals significantly more funds in the next round of stimulus. I recently joined, at the request of our U.S. Senate delegation, I've recently joined with the governors of Wisconsin and Pennsylvania to call on the president to support another $500 billion in stimulus funds to state stabilization funds to help us. I know you've probably heard Senator Mitch McConnell suggest that states should consider going bankrupt or declaring bankruptcy. I think he's since walked those back, but I do recognize that there is going to be a lot of competing philosophy around what these stimulus funds can be used for and what the amount of them is. And so I would just encourage every one of you to shoot over a communication to your congressperson and to our U.S. senators and support a fourth supplemental that has additional funds and gives us the flexibility we need to prioritize how those funds are used. While the education of our kids is not a direct expenditure because of 19, there's no question that it is a needed expenditure because of COVID-19. And so we need the flexibility to make sure that we're able to do the things to mitigate the learning loss that our kids will have as we think about resuming in-person instruction in the fall. And that's just one of many, many examples of things that we're going to need to be able to use dollars for.
Yes, and thank you. You know, the Michigan Township Association belongs to a national association of towns and townships, includes all the major Midwest states and also New York and a few others. And we would be delighted to continue to use that connection in DC to advocate for this. And as well, Judy Allen, my colleague in our government relations team, has indicated that we are preparing a call to action to support exactly these kinds of measures here at the state and federal level. You know, Governor, you mentioned phase 4 before, and I think everyone is very curious about our ability to get back and serve our residents better, as well as our local businesses. Can you give us a little bit of guidance based on your discussions with the scientific advisors and the Economic Recovery Council? What does the timing of that look like, do you think?
Well, we know that COVID-19 generally is about a 2-week period before an activity is seen in, the presence of COVID-19 cases, a spike. So the conventional wisdom, I think, would be that we would wait 2 weeks between phases. Now, we have moved some things quicker than that. And sometimes if you see, sorry, that's my dog. If you see a spike, you might move slower than that. Our hope is that everyone continues to do their part and take this very seriously and observe these important, measures, wearing a mask and the distancing, so that we can keep COVID-19 from community spread and take that next step in a couple of weeks. That's the hope. I haven't set specific dates. I know that would probably, people would like that, but our concern, of course, is that a lot of this depends on human behavior, our ability to turn that dial. And so we're going to continue to measure. What's our testing showing? What is our PPE? What is our ability in our hospitals? And do we see a regional difference? All of these will be factors into how we turn that dial and when that is.
So, Governor, a practical question. Our clerks are preparing for the August elections, and we were asked, do you believe that they're likely to be run like the May elections, in which we had one polling place open in each of the townships? What are your thoughts on the direction of our elections in August and perhaps November?
Well, first, I would want to give great kudos to all of the clerks that conducted these elections. We had twice the turnout we usually do for a May election. And I was really so happy to see how people were able to cast their ballots and do so in a way that kept them safe. And I think that was a great thing. So I would anticipate that we will need to run elections similarly. I will, of course, be taking counsel from our Secretary of State. She is the expert in this realm. But when you look at the outcomes, that twice as many people were able to participate, that they were able to do it from the safety of their homes, I just think that this really was showed us that we can do this. And I think that we should think about how we sustain that ability. We know that until there's a vaccine, COVID-19 will continue to be present. And our hope is that we can, through our own personal conduct, keep it from major community spread, but it will be here well into the fall. And so I do think that it's most prudent for us to move forward and utilize all of these lessons that we've learned in May toward August and November.
Another area where, the townships are sort of paralleling the state is in our township parks. So the state parks have taken the step of making them safe by keeping them closed. The townships operate some of the most beautiful recreational parks around the state and are kind of curious about the potential for opening, recommended of delayed opening. What are your thoughts on guidance there, Governor?
I think that, one of the things about the spring and summer in Michigan is, there's nowhere better to be. And we all want to get outside. I'm, even on a chilly day like this morning, I loved getting out there and walking my dog this morning. And I know that our parks are some of the finest offerings, and at the local and state level, I mean, you can't beat them. I'm working very closely with the director of DNR as well as the state medical executive to make determinations about when it will be safe to start camping again. The concern, of course, being the public bathrooms and facilities that people would necessarily be in close quarters or touching a lot of the same things. And so I can't say with certainty what that's going to look like. I do know that our parks for camping will not be open before Memorial Day. That is something that we thought was important, and that the timing is, we're just not there yet. So, my hope is that we continue to keep our parks open for day trips, that people are encouraged to get outside so long as they're continuing to do the distancing. And if they can't do the distancing, they have a mask ready to put on if they're not already wearing it. It's the Mackinac Commission, the Bridge Commission, is making a determination this week about the walk on Labor Day, and they're asking me right now, what do we need to know? What do we need to be thinking about? And we couldn't have imagined being in this place 4 weeks ago, right, where we can talk about re-engaging because our numbers were just exponentially increasing. We had the third highest number of positive cases in the nation. Now it's very different, and so where we are 4 weeks from now could hopefully be as dramatic an improvement from where we are today, and we can have talk about re-engaging some of those things that we probably can't do right now. But I think parks are a great space for people to get out and get fresh air and get some exercise and get some relief from being inside, and all of those things are really important right now, especially.
Kind of our last question. We are very interested in keeping our residents safe and also helping our businesses recover and restore this vitality to our communities. Do you have any specific recommendations on how our townships can help in that process?
I think that obviously businesses in your jurisdiction are wondering what protocols do we need to start using to prepare for reopening when it is our time. We've really been working with industry to promulgate protocols. It's really interesting to me. A lot of businesses have asked us to do that because they want direction, but they also know that when the state articulates it, it gives their employees and the general public confidence in safety. And so it's good for all of us to be on the same page. Some businesses, though, have said, we know better than the state. And we agree. That's precisely why we're working with industry to promulgate what practices should look like. But to the extent that you are able to share that guidance and amplify it, I think will help assuage some of the concerns. To the extent that at the local level, you can reinforce the behaviors that we're asking of our citizens so that we stop the spread of COVID-19, that's really important. I've been wearing the mask every time I'm out in public because I think it's important, even if it's not an enclosed public space, for people to see this is the new normal. This is the expectation. And when we all do our part, we all benefit. And so by modeling the behavior we're asking of others and empowering businesses in your jurisdictions to know what those best practices are and how they can go about meeting them is going to be really important. I think one of the things that we've seen in the last 2 weeks is the governor of Georgia has said, we're going to reopen, but people are scared. And so a declaration from a governor doesn't change human behavior if people don't feel safe. And while businesses are technically open, if the customers aren't showing up because they're fearful, it's actually worse for the business person because they don't have the protections of the stay-home order, but they don't have the clientele that support the business. And so that's why we've all got to stay really close and be on the same page here to make sure that we are confident it's safe to move forward, but we also give the public the confidence that they're safe too.
Governor, thank you very much for your time today and your leadership for our state, our townships, and the residents our township officials serve. We look forward to working with you and your team on public policy directions, as well as implementation of these changes as we bring our state to recovery. Thank you again very much for your time.
Thank you. Thank you, everybody.
So today, the Michigan Township Association had an opportunity to speak with Governor Gretchen Whitmer about where we are today and what is anticipated to be coming in the COVID crisis period and recovery. These are important and difficult issues for all of us to deal with. I want to thank our team in government relations, and I want to thank all of our members who continue to provide us insights about the challenges, the difficulties you're facing, and some of the positive moments as well. This video is one of our series called MTA Q&A, and certainly by being able to speak with the governor, we've had a very authoritative view into our status. As things change, I urge you continuing to look at the Michigan Township Association website, michigantownships.org, where right on the homepage, we have a link to our coronavirus resources page. There's a weekly coronavirus email newsletter, as well as our usual Insights newsletter. In any case, you can contact us at any time and speak to a member of Information Services professional or one of our other staff. Thank you very much for your support of the Michigan Township Association. We hope that you stay safe, stay healthy, and let us see the state get back on its feet as quickly as possible. Thank you very much.